Okay.
Fantastic. The
Yes,
floor.
my name is Gatenet. I'm from Ethiopia, and I'm from Ethiopian Animal Health Institute, and my institution is a national reference lab as well as a designated laboratory for transboundary animal disease in the Eastern Africa region. So my presentation is structured in this way. In the first few slides, I will talk on the epidemiological context of BTV in Ethiopia, and then I will present evidences on the effectiveness of BTV control measures in Ethiopia, particularly on test and segregation and BCG vaccination. And lastly, I will forward a few concluding remarks. So in Ethiopia, cattle population is very high, and taking all livestock together, the contribution to the national GDP is about 20%. So its considerable impact is on the economy is very high. And considering the growing demand of animal sourced proteins in the country, the government formulated a long-term master plan aiming to intensify the livestock production system in the country. However, as the intensification progress, the risk of disease emergence, such as bovine TB and others, is growing, and this challenge is further exacerbated by the lack of effective movement control measure in the country. As available data showed, in Ethiopia, about 4 million cattle population is infected, and the extent of BTV prevalence varies from region to region. In the central area, as you can see in the map, the prevalence is very high, and the distribution among the herds is relatively higher as compared to the peripheral regions. And the general pattern of the BTV extent in the country generally coincides with the level of intensification, and intensified zones are generally hotspots for the BTV transmission. And in this slide, the growing prevalence and rapid spread of BTV have posed a serious threat in the country, and this necessitates urgent implementation of control measures. As you know, the conventional test and cull approach is not economically feasible in Ethiopia and other developing nations. Therefore, assessing alternative control options to determine the most feasible option is more preferable in our situation. And from earlier data to control BTV, the test and segregation approach, a century long history, first developed by a bank. A method in the early 19th centuries is the one which everyone remembers. And in the country, in Ethiopia, we also evaluated the effectiveness of test and segregation and the TB control. So our recent research output published in scientific reports here it demonstrates that the test and segregation is one of effective control measures that's economically feasible. And this research was designed with the objective to compare the effectiveness and the costs of test and cull with test and segregation. And the second was to evaluate the diagnostic thresholds in high prevalence setting. So the output from this pilot study conducted in Ethiopia will be presented in this slide. The study was conducted into infected dairy farms, and one of the herd we applied the test and cull, and the second test and segregation. So if you see the panels of these graphs on the right-hand side, the output from this study showed that both test and cull and test segregation helps to achieve BTV-free status after a couple of repeated testing. So cost-wise, comparing the test and cull and test segregation, the cost for test and cull was generally high, and at the animal level, the cost for test segregation was half the cost of test and cull per test animal. So generally from this study, it has been concluded that test and segregation is economically feasible and effective and could be implemented along with zoning, compartmentalization, and herd certification programs. In this slide, I would like to emphasize on the test threshold. As you know, it's evident that the effectiveness of the control program, whichever option we use, is severely affected by the imperfect diagnostic tools we have. So the standard method is less sensitive, as you know, to detect the true prevalence, the true positives, and use of a severe threshold is preferable and have a good chance, a good effectiveness in detecting positive animals. So in this panels of graph in the left-hand side, which is generated from skin tests of lesioned BTV lesioned animals, the standard method, which is a comparative cervical test greater than 4, showed that it meets some of the reactors, some of the infected animals, while the other interpretations like the CCT greater than 0 and single cervical tests showed improved detection. In creating a clean herd, we advise to use severe thresholds instead of the standard cutoff. Therefore, the need to use a threshold or other tests with more sensitivity is mandatory and is very recommended if we need to achieve clean herd from BTV. And the other point in the panels of graphs in the middle is the issue of desensitization. So we repeatedly test the animals while removing reactors either by test and cull or segregation. The issue of desensitization is one area which needs consideration. So our results in this graph show that individual animals during each round of testing, the dots are the results from each the test results from each animals in each round, and the results showed significant differences in skin thickness between the first round and the subsequent rounds across various thresholds. That is, even in the single cervical test, even in the PPDA, and also the comparative cervical test. So this shows that development of desensitization is one point which every one of us consider when cleaning herd from BTV. And the right, the heat map figure shows a gradual decrease in skin thickness measurements when we use the skin test. So we did 5 rounds. In these 5 rounds, the skin thickness was gradually decreasing. So despite of this, all animals tested by other more sensitive tests, that is a AGRA test, showed a better result. And we found that AGRA test is showed no evident desensitization as compared to the other skin tests. So this makes IGRA test a more reliable option for a short interval testing. However, its use is currently limited by cost, highlighting the need for more affordable alternative test methods. This is the second paper from our BTV team, and the paper is published in the Science Journal, and the paper generally highlights the effectiveness of BCG in the BTV elimination. So in this slide, this slide details the purpose and the outputs of from the research paper that I showed you earlier. The purpose of this research was to address existing knowledge gaps. The first was to quantify the direct and indirect effects of BCG on BTV transmission. And the second was to assess the long-term impacts of routine BCG vaccination on the spread of BTV in the Ethiopian dairy herds. So as you can see on this graph on the left-hand side, the picture in the left-hand side, the study was based on an innovative crossover natural transmission model with cedar and sentinel animals. And in the first phase, the biological replica of confirmed infected cows were served as a cedar for vaccinated and unvaccinated sentinels, and disease-positive sentinels from the vaccinated and unvaccinated groups from phase 1 were served as a subsequent cedars for the new batch of vaccinated and unvaccinated cedar sentinels in the phase 2. So with this experimental design, in the panels of graph in the middle, showed that there was a remarkable difference in infection rates as well as in total lesion score between vaccinated and unvaccinated sentinels. And same time, and the phase 2 of the experiment, where the vaccinated sentinels served as a cedar, the difference of the infection rates as well as the lesion score between the vaccinated and the unvaccinated sentinel were not significant. And this indicates that the infectiousness of infected cedars were dropped drastically. And the bottom right graph shows the direct efficacy of BCG, which is about 58%, and the indirect protection, which is about 74%. So in total, when combined the direct and the indirect effect of BCG, the effectiveness of BCG raised to 89%, which is very, very important. And the graph on the right top shows the total efficacy. That's the total efficacy of the BCG can drop the transmission rate, the transmission threshold lower than 1, which means if we apply vaccination routinely, then the transmission threshold can be lower than 1. That means transmission will be stopped there. And in this slide that what I want to show you is in the figure in the left labeled A and B. There, this just show you the Ethiopian situation where we determine the reproductive ratio and the reproductive ratio varies among herds. It varies depending on the herd size as well as the stage size. So in overall, the total population average of Arnolds in Ethiopia is about 3.3. And using this basic data, in the figure in the right, which I need to emphasize, we did a scenario analysis to see the prospective use of BCG in cattle herds. So a stochastic population transmission model was developed, and the model was calibrated with the data that I was talking, and cattle movement model was estimated from three emerging dairy areas, that is Gondar, Mekelle, and Hawassa. And this was just to project how the prevalence of BTV might be expected to evolve over the next 50 years. So the model showed that routine calf food BCG vaccination has the potential to prevent the predicted expansion of BTV in the dairy herds and bring the population average R0 lower than 1 in approximately 10 years. So this results in a substantial decrease in the predicted BTV prevalence. So if you see each graph, the upper one is for the animal level, and the lower one is for the herd level projection. So from this scenario analysis, we can deduce that the critical BCG is a critically important in BTV control. So considering the direct and the indirect effects of BCG is critical in eliminating BTV. So as a conclusion and way forward, from the research findings we have, we concluded that test and segregation of test positive animal is a viable approach for the BTV control with a lower cost implication and optimal effective while using a more sensitive test methods. And the second point is use of BCG is an effective approach in resource-limited settings. Eliminate BTV in 10 years because of the substantial indirect effects. And the third point is combining vaccination and test and segregation could result in synergistic effects in the BTV control. That's the output from our research. And lastly, as a path forward, the larger we have planned that large scale field study is critical to see our findings in a field situation. So this will include integrated disease management system for health improvement. So I think with this, I will stop. But before I conclude, I would like to express my gratitude to members of the ABTV consortium from Ethiopia, from India, from the USA, the UK, Canada, and all colleagues whose name I am not able to mention due to the large list, and the funding agencies, including the Bill and Melinda Gates Foundation, the Foreign Commonwealth and Development Office, and of course, the Penn State Hook Institute of the Life Science, a key driver of the FT project, particularly Professor Vivek Kapoor and his team, and WAHA, lastly, for inviting us to present our findings. And thank you so much, colleagues. This is my presentation, and over to you.